Okay, lovely. So we might have more people joining as we go, but we will catch them up. Just to do some quick introductions, my name's Nikki. I am Head of Training and Development here at Mind and Mid Hearts. Um, I've worked in mental health sector for 22 years. Gosh, that number is starting to mount up. Both clinically and in education and the NHS and voluntary sector. I also have my own lived experience of poor mental health. So I have also been an employee with poor mental health and had to get support through work for that. So I've been on both ends of the spectrum. So I'm happy to answer any questions you have from either perspective. I've supported numerous organisations locally implement mental health peer supporters into their organisations and have learned a lot during that process. So again, hopefully we can kind of share some of this knowledge with you today. I'm here with my colleague Stacey, who's going to introduce herself and is going to kick off this part of the webinar. So I'll be in the chat if anybody needs anything, and I will see you a little bit later on in the webinar.
Thank you, Nikki. Good morning, everyone. My name is Stacey, and I'm a training officer here at Mind and Mid Hearts. I've been in this role since sort of November last year, I think, and similar to Nikki, I have my own lived experience. I've had poor mental health since I was a teenager, and I've also supported loved ones with their mental health as well. So that's me in a nutshell. Let's get started. Thank you so much for dedicating some time for us today. Today's webinar is all about the importance of supporting mental health in the workplace. Sorry, just here we go. We are from Mind and Mid Hearts. If you haven't heard of us before, that's okay. You might have heard of Mind, though. We are affiliated with National Mind. They work across England and Wales, promoting mental health, raising awareness, working with the government on policies and mental health acts and that real top level stuff. But there are 100 different local minds across England and Wales. We are your local mind here in Mid Hearts, so we work across St Albans, Stevenage, Hertford and Hatfield, and the rest of Hertfordshire as well, offering services that actually support people in the local area. So anything from training to counselling. We also run peer support groups, active support groups, and so on. If you're interested in any more information, if you'd like to join our social media channels or join our newsletter, then you can just scan that QR code on the screen there. Okay, before we begin, I just wanted to clarify today's session. Obviously, we started at 12, and I don't expect us to go on any longer than 12:45. We'll have time for Q&A at the end of the session. So if you could just stay on mute until we have that Q&A at the end of the session, that would be really helpful. You can either unmute yourself at the end or use the Q&A function to ask questions. Nikki and I are also in the chat if anything does come up throughout the session. Just to let you know as well that this session will be recorded and sent out to you at a later date so that you can look back. Today, we are going to cover the role of mental health peer supporters in the workplace, list the benefits of having mental health peer supporters in the workplace, identify the steps needed to implement mental health peer supporters, and learn about our offerings here at Mind and Mid Hearts. Okay, so I hope everyone's in the right place. Let's begin with just clarifying what mental health is. So Mental health is more than just mental illness. It's more than how we think and feel. It's how we engage with the world around us, how we build relationships and make decisions, and how it impacts our work and how we cope with day-to-day challenges, for example, work. Like physical health, we all have mental health, and just as our bodies can become unwell, so can our minds. And just as with our physical health, we need to look after our mental health before we become ill. A mental health problem can affect all of us, regardless of age, race, religion, or income. And it's not a result of personal weakness or lack of character. But mental health isn't just a personal issue, it's a workplace issue as well. Oh, before I change this. So 1 in 6 workers experience a mental health problem each week. And according to the 2025 burnout report, 9 in 10 workers report experiencing high or extreme levels of pressure or stress in the last year, with 1 in 5 actually needing to take time off work due to poor mental health caused by stress. That's 21% of people taking that time off. Anxiety about redundancy currently affects 38% of workers. And there was a small increase in the number of UK workers reporting that their organisation has plans in place to spot signs of chronic stress and to prevent burnout. But 45% of UK workers don't think that such plans are in place, meaning that they're not feeling adequately supported by their employer. And according to the Deloitte Mental Health and Employers Survey, this loss in productivity, absenteeism, and presenteeism due to poor mental health is costing UK businesses an estimated £51 billion each year. So it's having a huge impact on workplaces. But we do know that when we create a sense of community at work, we help build that resilience and we help people to thrive at work. So this image demonstrates that our three-pronged approach to dealing with mental health in the workplace. So essentially, it's demonstrating that we need to be mindful of mental health and well-being for every person at every level, at every point in the recruitment process. We don't want to wait until people are at a point where they're struggling with their mental well-being before we take action. So at the top there, you can see support for all employees to thrive. So whether they've disclosed a mental illness or not, that means ensuring that everyone has a good work-life balance, they take their breaks, they have equal opportunities, and so on. And then below that, we see targeted support for those who are struggling or ill, considering any reasonable adjustments that may be necessary. So having a peer support program embedded in your organization can be really helpful for you to achieve this. So let's move on to actually understanding peer support and the role of a peer supporter. And it's really important to remember that peer support programs look different for every organization based on their specific needs. But essentially, a peer supporter is someone who advocates for mental health. So they take action to raise awareness of mental health and challenge stigma. So stigma is when people have a negative attitude towards someone with mental ill health and may treat them differently or badly. Peer supporters can also help their colleagues who are struggling with their mental health by advising them on appropriate support services, both within and outside of their organisation. Peer supporters aren't expected to be experts in mental health or to diagnose mental health problems. Their role is simply to promote positive mental health and to signpost to relevant support and help where appropriate. Anyone can be a peer supporter, and they don't need personal experience of mental health problems. But those who have lived experience of mental health problems may find it helps them to start conversations and challenge stigma. But any action that a peer supporter takes, no matter how big or small, helps us to end stigma and raise awareness of mental health. There are lots of benefits to embedding peer supporters into your organisation. We're just going to go through a few. So, talking about and promoting mental health reduces stigma. And when stigma is reduced, we're promoting mental health and we're talking about it openly. We create an environment that feels safe and healthy. And when people have these basic needs met, such as feeling safe, they are more likely to be productive. As we mentioned before, anyone can become a peer supporter, and those who do build on their skill set and confidence in supporting others. And that means that your staff are all looking after each other, and then it's not always falling to management. In addition, upskilling staff increases their sense of empowerment and feeling like they are making a difference to the people around them. You'll see improved connections and relationships between colleagues. You will see an increase in self-esteem and positivity about the future, especially for the people who are being supported. They'll find that their mental health and well-being is improving. They'll find that they have access to support and lead healthier lives at home and at work. So there'll be this greater feeling of acceptance and an understanding of their experiences. Also, by creating a peer support program and upskilling your staff in-house, you're reducing costs by not having to bring in external trainers, external services. And this can be particularly important if your organization is seeing structural changes or a reduction in budget. And ultimately, when people know that their mental health is being supported, it improves culture and the working environment, creating a happier and healthier workforce, ultimately improving staff engagement and retention. Thank you. Nikki, did you want to take over?
I do indeed. I'm just trying to deal with an issue in the chat that someone's having.
Oh, no.
I know. Okay. So I will do my little spiel for you, and then I'll come back to helping you. Apologies. Apologies if anyone else can't see the slides. Sometimes this happens, I think, with external people coming in. Just looking at how to try and get that sorted. Okay, so we've discussed a little bit about how important mental health peer support can be, but on a practical level, let's see a kind of how you can get started. One of the things I often hear from the organisations I work with is that they're really keen on implementing peer supporters, first aiders, champions, whatever they want to call them. However, they really worry about that process of how to get started. It can feel a little bit daunting. So we thought we would just give you a few tips on what we know works really well. So starting off, there are two main things to firstly consider, and I'm sure you can guess what they are. So it's time and money. So when we're establishing and managing kind of a new program at work, obviously it's going to take up a little bit of staff time. So really thinking about who's got capacity to do that and how you can free up people to be able to think through this process so that it can run effectively. We often find that if the planning is done well, then it kind of streamlines the whole process and prevents issues down the line. And obviously budget. So often there's a small amount to pay for training, and any resources that people need. What we do know and have seen is that peer support can be a really cost-effective way to implement that support in the workplace, just as Stacey was saying. What you're really doing is upskilling people in your workplace to have those conversations. So it doesn't always fall on managers or external agencies in order to meet the needs of those people. So once we've got the time and the budget sorted, there are a few questions that we find that it can be really helpful to ask ourselves when we're starting this kind of process. And it can really help as well to get kind of the decision makers on board as well, because you can provide a very clear, concise ask of what you're then prepared to offer or what the program will offer the organization. So some of the questions we find really helpful are these. So starting off by thinking, why does the organisation want to implement a mental health peer support scheme? So really kind of nailing down on that why and thinking about who will benefit from the scheme. And often it's worth thinking about kind of the wider stakeholders. So you not only will your employees benefit, but your customers, because they will be on the receiving end of individuals that are happy, healthy at work. And also the bottom line in terms of finances as well. We know that so much money is lost each year to poor mental health at work. So also thinking about that business case can really help getting those decision makers and your senior leadership on board. We want to think about what we want to achieve and then what resources and training do we need in order to do this well. Might also want to think about what will motivate people to take part in the program. So those employees that are going to seek support from the program, and also those kind of peer supporters that are going to be delivering that function as well. When I think about where and when the activities would take place, and also how people should approach peer supporters. So it's those real kind of logistics practicalities. So I've worked with organisations that have been very unclear about these questions and down the line have had to really try and figure it out. And we find that when we put in good boundaries to begin with, that's when things run smoothly. So for instance, I was working with a blue light service, and a peer supporter was saying to me, you know, I'm available whenever someone needs me. I'm available 24/7 if someone needs. So I asked them, you know, what about if someone was going to approach you at 2 a.m. on your personal mobile every day? Would that be okay with you? At which point they don't know, that would be a little bit too much. So we all have boundaries, and those boundaries can change depending on who we are and what organisation we are. But we want to be very clear how you approach peer supporters and what the offer is and what the ask is and what their availability is. So these can be some really good questions for us to kind of start thinking about that process. What I do also find is that a lot of organisations get caught up on making it perfect, and therefore it never gets done. So just remembering you don't have to kind of start big. Sometimes it's worth just piloting how these things, training up a couple of people and seeing how it goes, and remembering that it's going to look different for every organization. Every organization is unique, has a unique culture and unique requirements. So what kind of mental health peer support, mental health first aid, whatever you're going to call it, looks like in your organization is going to be different from other organizations as well. Oh, we've got a slide missing. Once we are very clear on what we need, we want to put an action plan into place. Now we have an action plan that we can send to you, and basically this is a plan that looks at the designing, the planning, the developing and the delivery of the program, and really invites you to think about who should lead on this process, what support you need, what are the timeframes, what are the KPIs, so you can really start to think out that process. And what we find from the organizations we work with is having a structured approach to that can make it feel less overwhelming, and it's just just another project that you're implementing, rather than it being something scary, which often we find when you mention mental health, people think, oh God, we can't do this. So it's really simple, really easy framework for you to work with. And when we're thinking about our program, our peer support program, really helpful to think about kind of time frame. When do we want to get this started? The goals of the project, any KPIs that this can kind of go against, roles and responsibilities of everybody involved. So you might want to have a peer support lead that's overseeing the project, and then peer supporters. So thinking about what's their role and responsibilities, and then also thinking about how does this fit in with our wider kind of wellbeing initiatives? How does this impact on existing policies and procedures? So once we've done all that, we can start to think about how do we recruit mental health peer supporters. So when an employee wishes to volunteer as a peer supporter, we want to kind of celebrate and embrace that. However, recognizing that not everybody that volunteers is going to be suitable. Often we know that people that have their own lived experience often want to support others. So it's being really clear about kind of if that person feels willing, able, and are getting the right support in order to offer that expertise to other people. We want to make sure that employees fully understand the role that they've signed up to, and they have the skills, the experience, and knowledge necessary to fulfill it. So we often find it's really good practice to go through a recruitment process, have a job spec, and to go through kind of a formal process with people. Before you begin, it might be worth speaking to your HR team, see if they've got anything existing in place, tools and forms that you can use. But just some ideas to get you started is you can think about a job description, and we talk about being very clear on that job description so people know what they're signing up to. When we work with an organisation, we have a toolkit that we give people that gives an example job description that they can use, which can kind of help people as it gives them a bit of a starting off point to tweak. We want to kind of promote the opportunity using all our internal comms, and we want to kind of also promote the benefits of kind of being a peer supporter as well. You know, that increased knowledge, feeling kind of good about supporting people. We know one of the 5 ways to wellbeing is about giving and supporting others. It does huge things for our self-esteem and self-worth. So worth also thinking about that kind of development that people are getting as well. You want to kind of assess the applications that you get. Like we said, not everybody will be right. So an assessment panel could do that for you. But then kind of really being clear with participants that were successful and unsuccessful about the reasons why, and also seeing if unsuccessful candidates might want to support in other areas that of work that you're doing around mental health and wellbeing initiatives as well. And now, once you've got your peer supporters in place, you want to think about their support. So traditionally, there has been this kind of wave of upskilling people in kind of mental health first aid, for example, and then sending them on their way to just kind of get on with things. But it's really helpful for you to think about what are your peer supporters going to need to stay well? What support are they going to need? So the first thing to think about is their training. What training are you going to provide them? So say we do mental health peer supporter training. It's a 2-day training that Stacey's going to talk to you about, that gives people everything that they need to really feel equipped to do the role and to feel confident at doing the role. You might want to think about what existing support you have in place. So do you have EAPs in place? What support is in place for those individuals? Can you implement new kind of services for them? So we offer supervision for our peer supporters, which is monthly or quarterly, to support them in their work. Can you provide them with kind of a handbook of kind of places to signpost to, giving them all the information they need to do the job as best they can? And thinking about wellness action plans. So these are easy and practical ways to get people to think about their mental health. So it's a document, a tool that you sit down with people for them to think about, what do I need in order to stay well? So having those conversations with our peer supporters, making sure that they're modeling what they're offering other people as well. So I hear that the sound is, and I can see in the chat, it's not very good, and I can hear myself twice, so it's quite off-putting. So I'm just going to hand back to Stacey, who's going to go through the training element with you.
Thank you, Nikki. Um, so as Nikki just said, we do offer peer support training here at Mid Herts to ensure that your peer supporters are feeling really confident in fully understanding mental health, spotting the signs of mental health issues, and knowing how to support someone and signpost them when needed. It also gives peer supporters an insight into caring for their own well-being, which is really important when you're in a caring role. We here at Mid Hearts, we're made up of mental health practitioners and experts, and many of us have lived experience perspective that we can bring to the sessions as well. So there are two options. The first option is open courses. These are delivered online over 2 full days, and they're best for individuals with small numbers of people who want to do the peer support training. So, for example, Nikki said a moment ago, you might sort of want to trial this peer support program. So you might just want to send 1 or 2 people for training. This is a really good option for that. The other benefit to going on the open courses is that you'll have the opportunity to interact with people from across different organizations. So you can really learn from each other, see what other organizations have planned, how they cope with the well-being of their workforce. We have a couple of dates coming up in July, which I'll move on to in a moment. The other option is having in-house training. So this can be delivered online or in person, and it will just be people from your organization. This means that the times and the dates can be flexible to suit what's going on with you guys, and it's best for more people. So if you have between 3 and 16 people that you want to train as peer supporters, then this is a really good option for you, because then those peer supporters are already starting to build relationships with each other so that they can support one another through this process. It also means that the content can be adapted to your organization's needs. So, for example, if we were to use a case study or examples, then they can be tailored to something that is actually relevant to what it is you do in your organization. We do offer ongoing support as well for this option. So whether that's drop-in sessions for those peer supporters, if they need some advice or support, then they can contact us. We can either do that online or via email. And whichever option you choose, the learning is the same. So each participant receives a certificate and a workbook to support their learning. And I just want to finish with some practical steps that you could take today. Once you leave this webinar, you can talk openly about mental health, ask someone how they are, whether you're having a one-to-one, whether you've got a one-to-one scheduled in the diary, or if you see someone later today, ask them how they really are. Empower teams. Ask them what it is that they need, whether they feel their peer support program would benefit them and your organization. And just go away and consider what we've spoken about today, how peer supporters could benefit your organization. If you are already interested in booking a online course, an open course, the details are there on the screen for you to book now. So you can either scan the QR code or use the short URL there. But just remember that small changes can spark big results. So whatever it is that you choose to do today, it will make a difference to someone's day. So we've come to an end now. Thank you for attending, and I would really love to hear some Q&A from you. We already have, sorry, just going on to the Q&A function. Penny has already started the discussion, which is great. What are the key differences in peer supporters to mental health first aider? Nikki, would you like to take that one?
You're asking me because you know I'm passionate about this.
Yeah,
So it's so
I know
mental
you've
health
got it
first aid
all.
is brilliant. It's
Good, good.
brilliantly marketed. You know, people know what first aid is. Our course is very similar in that it's to do the same job, which is upskill people to feel empowered to be able to support people. The main difference is that we don't just focus on crisis. So it's not about kind of first aid when people are struggling and in the midst of a mental health crisis. We do quite a bit of work around kind of noticing those early signs of poor mental health so you can get in there and have those conversations. So it's more preventative in nature than the mental health first aid. We are also a local charity, so we feel that that's one of our strengths in the fact that we are local. You can pick up the phone, have a conversation with us anytime, and often the peer supporters I've trained will pick up the phone and say, you know, I've had this interaction, is this okay? And they normally do brilliantly and just need a little bit of that reassurance. We also provide that ongoing support, so we provide kind of resources and supervision for people that we train. So we think it's really important to have that relationship with the organisation if that organisation wants that. That's really important to us. And finally, all of our trainers are mental health practitioners and have lived experience. So it's not that we kind of train people up to deliver mental health first aid and send them on their way. Our trainers are mental health professionals and also have that lived experience perspective as well, which is a little bit different than mental health first aid. So there's a couple of kind of key differences. We tend to find that organisations will just kind of use the labels around kind of peer support, first aid, champions, whatever feels right for their culture in their organisation as well.
Thank you, Nikki. Helen has asked, how do we measure success of mental health first aiders? Happy to come on and share more detail. Yeah, would you like to unmute yourself and ask your question?
So it's really interesting question, Helen, because different organisations look at different measures and have done different things over the time. So some of our peer supporter programs are very much confidential. And the organisation will say we want to hear nothing about the conversations that are happening. Other organisations, so some of the blue light services we've worked with, manufacturing, need a little bit more transparency due to kind of health and safety and the nature of the work they're doing, so require a little bit more feedback. But that's within the boundary of kind of the organisation to work out when you're looking at what does peer support look like. We've had some programs that really kind of want to measure the impact. So they will kind of use the data from the conversations that they're having to look at the well-being of the organisation. So one organisation we work with will record kind of the amount of conversations they're having. What is the kind of topic of that conversation? Is it stress? Is it anxiety? Is it work-life balance? To try and get a sense of what that is. And then what the kind of departments are having those conversations, so they can kind of see that the issues that their staff are dealing with, the parts of the business that are being affected, and how many conversations are happening. So I think it's really kind of up to the individual organisation to think about, well, what are we trying to achieve, and then how are we going to measure that? And we can kind of help you think through that if that would be helpful on how you do that. I'm just rambling away while you're trying to work out how to unmute. But hopefully that answers your question. Are you able to, can we unmute? Is it something that we've got the gift to do? Allow mic. There we go. So you should be able to
clever.
unmute now. There you go.
Can we do that for everyone?
Yeah.
Thank you for answering your question. No problem. Did anyone else have any questions? Please feel free to type in the Q&A box or unmute if you can.
Or if you want to be unmuted, just put it in the chat and I will allow Mike. And apologies to people that have had trouble kind of being able to see the slides. Like we say, we'll send out the recording, we'll send out the slides to make sure that you have all the information, but also feel free to reach out to us and we can arrange kind of a one-to-one if that would be helpful. Any other questions? If not, we can give you back the gift of time and give you 5 minutes back. And the invitation would be to use that 5 minutes to do something that's good for your well-being.
There is one chat that keeps coming up and I can't see it. Can you see a
Oh, it's
message
coming.
from design?
Yeah, I can.
Okay.
Yeah. But I will respond to you.
Thank you. I'm glad that you've found today's session useful. All the slides and recording will be sent out to you ASAP, along with hopefully some useful tools.
And if you find that you are thinking about kind of implementing kind of a program that's going to support, be kind of along the peer supporter route, feel free to reach out to us and we can have a chat and support you in any way we can. We know it's a difficult time. You know, we're seeing more poor mental health than ever before. We are seeing increased stigma that we've never seen before. I think because of the amount of poor mental health that's out there, it's increasing the stigma. And businesses are struggling, you know, businesses having to make really difficult decisions about where they spend their money. So anything we can do to support staff, support people, as well as support businesses to thrive, that's kind of what we want. So do reach out if we can help in any way. Okay. Thank you. And with that, we'll say.
Oh, we have another question. Thank you. From experience, what would you say the biggest blockers companies have for peer supporting process once set up based on feedback?
From experience, what would you say the biggest blockers companies have for peer support process once set up based on feedback? So there's a couple of things, and I feel like we have the toolkit which kind of eliminates some of them. I think now, firstly, is like the boundary question. So making sure our peer supporters are really clear on what the boundaries of the role are. And we do a lot of work around that in the training so that people feel really safe on what they're meant to kind of feed up back to kind of HR and what they can kind of keep themselves. So that's one blocker. I think getting buy-in from decision makers can also be a blocker for some organisations. Going in with those stats around kind of the mental health need and actually the money it's going to save organisations can really help with that. And then the piece around kind of capturing data. What we find is people that want to kind of be mental health peer supporters want to have those conversations and support people. They don't want to do admin. So getting them to fill out like a spreadsheet with their conversations can be a little bit challenging sometimes. So really thinking through that process of how you capture that data, if that data is important to you, that can also be a little bit of a challenge. But a lot of companies, or all the companies we've worked with implementing these programs, still do it. We've had none that have kind of opted out, saying like this doesn't work. Even if there's a few teething problems, we've had peer support programs that have been running for years and years and years and seeing really good results. So we always find a way through it. Okay.
Thanks, everyone.
Switching between screens. All right, lovely. So
I just
yeah, do
went back
reach
to
out to
this
us.
screen because if people wanted to book the online courses, the link's there for those of you who were
Perfect.
asking for it.
Okay. Lovely. So we will speak to you soon, hopefully, and see you on another webinar. We're going to have one a month coming up, so hopefully see you then.
Thanks,
Thank you.
everyone.